Welcome back to TV5 News at 9. Today, we are talking about another minimally invasive treatment with board-certified neurosurgeon, Dr. Jay Jaganathan. Thank you so much for being here, Dr. Jay. We appreciate it.
Thanks for having me, Colette.
Of course, you're welcome. Today, we're talking about steroid injections. So tell us a little bit about those, Doctor.
So steroids are anti-inflammatory medications. They're medications that suppress an immune reaction or in some cases inflammation. Usually steroid injections are performed along an area where a nerve is irritated or inflamed, or along a joint that's inflamed. And the result is to reduce the symptoms from compression of the nerve or from inflammation of the joint. And it's usually considered a first-line non-surgical technique in patients that have pain without a neurologic deficit before they consider surgery.
Now, doctor, are there different types of these injections?
Yes, there are a variety of pain injections that do exist. Classically, when patients think about steroid injections, they think only of epidural injections, but there are injections in the joint known as facet blocks, where is meant to reduce inflammation along the joint itself. Inflammation, a lot of times with patients who have sciatic type pain, can involve the sacroiliac joint as well, and that's another common area for injections. And then you can do trigger point injections, which are injections that are localized more to a specific area of the pain that may not fit a classical distribution, for example, along a nerve root or something like that.
Well, tell us this, doctor. You know, so many people they do not want to hear the word surgery at all. So what would you say to patients who do not want surgery?
So in the majority of cases, pain is treated non-surgically, even in cases where there is arthritis or a disc that's bulging. And I encourage surgery, even though I make my living doing surgery. We encourage patients to explore non-surgical treatments as a first route always. In some cases, what you do with the steroid injections is to identify a pain generator, which means you identify the source of the pain, which improves when you do the injection. And in some cases, even when an injection does give temporary relief, it can lead to more permanent solutions. For example, when patients have consistent improvement with medial branch blocks or facet blocks, rhizotomy, which is a procedure, also an outpatient procedure where the nerves that transmit the pain can be burned, that can oftentimes give longer relief of several months or longer without surgery. So if in cases where even where patients don't want surgery, the steroid injections might be a good treatment to control pain, to identify the source of pain, and maybe even to provide longer pain relief than can be gotten just with physical therapy alone.
So that should give patients a lot of peace of mind knowing that there are several options available. Where can people go to learn more information, doctor?
They can visit our website, mi-neurosurgery.com. My colleague, Dr. Novak's a board-certified interventional pain specialist, and they can contact our office, 989-701-2538 anytime.
I love that. Well, thank you for joining us. We appreciate you coming in.
Thank you for having me.
You're welcome. You can find a link to today's topic in the hot link section of WNEM.com.